Hi everybody, it's Dr. Molly McMullen-Laird from the Rudolf Steiner Health Center. Today we would like to show you how to do a chamomile inhalation. This is a very effective treatment for any kind of lung irritation, sinus irritation, beginning of a sinus infection and a persistent cough. The steam from the chamomile helps to loosen the secretions in the lungs and in the sinuses. It helps the little hair cells, the sweeper cells that move things out. And it humidifies the whole airway in the winter, especially when we're having very dry conditions in the house and during the night. I recommend for patients who are struggling with cough or sinus problems to try to do it right before going to bed, because during the night we dry out naturally from breathing through our mouth or just the dry air. All night we tend to dry out. And then to try, if possible, to do it again in the morning, to get everything moistened again before the day starts. And if we keep the secretions loose and keep things moving and clear, then it will be an advantage against developing either a sinusitis or a bronchitis with colored phlegm. So here's all you need to make a chamomile inhalation. You need a bowl. A flat bottom is nice, but you can use any kind of bowl. Loose chamomile flowers, and 4 cups of boiling water, which is in this tea kettle. The sheet is going to be used to cover the patient. So you just take about a palm full of flowers, about that much will work, maybe 2 tablespoons. Put it in the bottom of your bowl. And ladies, you also get a facial when you're doing the inhalation. So we're going to pour our boiling water over this, and you can see the steam coming up very nicely. And it smells lovely. I'm just going to put a little bit more, and we have some extra water later if we need to warm it up. And then you have the patient sit at the table with their head over the bowl of steaming chamomile, and you put I like to use a sheet to cover them so that you can completely cover the front and the back of them and tuck it in around the steam. So I'm not going to actually do this, just kind of show you how you would do it. So you're going to cover the bowl and the patient. If it's a child and you have a large enough sheet and a narrow enough table, you can have mom and the child underneath at the same time, so that the child, a small child, can do it on their own, and the mother can be under there with them, or whoever, the father, whoever's doing it with them. So this will stay nice and hot for about 10 minutes. You breathe in through your mouth very slowly and out your nose to clear out the sinuses. And if your sinuses are open, you can breathe in your nose, deep into the lungs, and then out the mouth. And try to get everything loosened up by very long, deep inhalations. If you feel a cramping at all, if it's too hot and the steam gives a little bit of a cramp or an irritation to the back of the throat, then either take your head a little bit further away from the pot of boiling water, or open up the sheet a little bit to get a little bit of cool air in. But you really want to kind of preserve as much of the steam as you can for the inhalation. And when it starts to cool down, then you can just open a tiny bit and pour some more of the boiling water into the pot. That's all there is to it. It's a very simple procedure and helps many people avoid sinus infection or bronchitis. Thank you.